Shalom, family. So in this video, we're going to talk about PCOS, which is polycystic ovarian syndrome. And it's a common disorder that affects millions of women worldwide. And among these impacted, of course, is Black women. And Black women face unique challenges as they have a higher likelihood of experiencing PCOS and its associated complications. So PCOS has a disproportionate impact on Black women, leading to lower chances of pregnancy, a higher risk of cardiovascular disease, and then also there's an increased rate of the growth of unwanted or excess hair in unwanted areas. So, what exactly is PCOS? PCOS is a condition in which hormonal imbalances disrupt the normal function of the ovaries. And so, women with PCOS often have enlarged ovaries that contain small cysts, which are fluid filled pockets. And so, this hormonal imbalance can also cause a range of symptoms, which include irregular menstrual cycles, weight gain, acne, hair loss, and also infertility. The exact cause of PCOS is still not fully understood. However, it's believed that it involves a combination of genetic and environmental factors. So, one of the important factors of PCOS that I want to pinpoint is insulin resistance, which is a condition where the body has difficulty processing insulin. And it's commonly associated with PCOS. 40% will get diabetes. And this insulin connection actually leads to an increase in the insulin levels in the body, which also affects the hormone production, which contributes to the development of PCOS or the continuance of PCOS. So PCOS is not necessarily totally reproductive. It's linked to a higher risk of developing other conditions, type 2 diabetes, like I talked about, high blood pressure, cardiovascular disease. And so while herbal reproductive support is beneficial, addressing PCOS is going to require a comprehensive protocol that's going to address the multiple imbalances that are present in the body. And so this includes supporting the pancreas, promoting healthy insulin levels. Another thing I want you to realize is that taking certain symptoms and trying to address them, like hair loss, for instance, and just using topical solutions to try to improve hair growth when it's caused by PCOS can actually lead to maybe temporary improvements. However, since PCOS is going to continue to cause the hair loss, the problem is likely going to persist. And so this predisposition to hair loss is primarily due to DHT, which is dihydrotestosterone. And women with PCOS tend to have higher levels of androgens, which are male hormones. So DHT specifically is associated with male pattern baldness, which is why women with PCOS are more likely to experience this symptom. So because we talked about insulin, which fuels the levels of androgens in the body, it's important that we also look to reverse pancreatic imbalances. So we can provide pancreatic support by having a healthy diet, making sure we watch the sugar, exercising regularly, also managing stress, because the stress can cause the blood sugar to spike as well. So sometimes it's not totally the food, but incorporating specific herbs as well that are going to provide support to the pancreas. All of these herbs, along with the lifestyle changes, is what you'll find can be beneficial for promoting insulin sensitivity and hormonal balance in women with PCOS. So by addressing the root cause of PCOS and then implementing a comprehensive protocol, that's how you can actually work towards reducing the risk associated with PCOS, promoting fertility, and provide an overall hormonal balance. And so I want you all to think about this when you're deciding of what herbs you should use, or when you're asking what herb is for PCOS, is thinking about all of these different things that are going on in the body. And so making sure you have a balance of the hormones, maybe getting rid of excess hormones. And I did another video, and I don't know the order in which I'll release them, but the other organs that are associated, other than the uterus, that are associated with hormonal balance, making sure that all of these organs are taken care of is going to be very important. Making sure that we're looking at the supporting the pancreas as well, making sure that we are getting rid of the excess androgens, if any, and making sure we have proper levels of the other female reproductive hormones, particularly estrogen and progesterone. Doing all of these different things is how you will see long lasting results and be able to actually get rid of the PCOS. So I hope this video was helpful for you. If it was, let me know down below. As always, if you made it to the end, thank you so much for watching, and I will see you in the next one. Bye.